So I'm sitting here just like most of you out there probably watching the Duke-UNC basketball game when lo and behold, on like literally the first play of the game, not only does Zion Williamson do something crazy like completely tear through his brand new basketball shoe, but then unfortunately go down and end up having to leave the game with a right knee injury. What's going on, guys? Welcome back to my channel. For those new, my name is Brian and I'm a doctor and a sports fan, and it's my goal on this page to combine those two interests to help look at sports injuries and sports medicine topics to help explain them and give some additional insight to them. Now, we don't know officially what happened to Zion's knee beyond that it's a knee injury and it's caused him to miss the game. So we can't talk specifics, but I do think it's still a learning opportunity to kind of take a look inside what's going on in my head as someone who might be sitting courtside covering a game, seeing an athlete go down with an injury like this. And so what I want to do in this first video is take a look at the injury footage to try to get a sense of what types of structures could be implicated in the knee whenever we have an injury like this. And then next I'm going to try to take you behind the scenes, so to speak, to give you some insight into what the different trainers and medical staff are going to be doing back in the locker room to try and evaluate, based on physical exam, what might have happened for his injury. Once we get some official word, we'll try to do a part 2 in this, talking about specifically what happened and the implications that might have on his career. But let's get started and first take a look at the footage of the injury. So early on in the game here, he has the ball, he's driving in, and as you can see him try to plant on that left foot, he's generating so much insane force that that left foot slides, and then, as we all saw initially, causes his shoe to just completely tear in half. I mean, I was an engineer before I went to medical school, and so I'm just trying to think through that crazy amount of sheer force that he must be generating to actually rip a shoe in half, and it's just insane the amount of power that his body can generate. And that kind of overshadowed what was going on his right knee initially. So we go through the sequence, we see him go down, kind of pick his shoe up, and initially he grabs back behind his right knee, suggesting maybe there was some pain behind the knee. But fortunately, he was able to get up and walk off the court under his own weight and then back to the locker room under his own weight. He's definitely limping a little bit, but was able to put weight on his leg, which is ultimately a really good sign. Think back to some of the other severe injuries we've seen recently, like the Victor Oladipo injury in the NBA. Definitely not putting weight on it, much more severe. So overall, good sign that he can bear weight. What I want to do next here is take some slow-mo views of that right knee to try to get a sense of what structures could be involved and implicated in a type of mechanism like this. As you can see, whenever he's going down, his legs are relatively spread apart, and we would call that abduction of the legs, so the legs being spread apart. You can see his right knee is significantly flexed or bent, and that leg just kind of spreads further and further apart, and that causes his right knee to bend inward. We would call that a valgus stress. Now, as he's going down then, he puts his arm behind him, trying to brace his fall, and that almost causes that knee to bend inward even more significantly. And I think that bending is probably what caused whatever this injury is. Now, what things do we think about with a knee injury? And there's kind of the 4 main ligaments that we consider, and then the meniscus. Now, of course, with injuries like this, people are always worried about, did he tear his ACL? Reassuringly, whenever an athlete is landing with their legs straight or their knee extended, the ACL is subjected to more stress than when the knee is bent or flexed. So it's reassuring that his knee was flexed more whenever this happened compared to, say, a football player who's planting, has their legs straight, and then takes a shot, causing that bending moment. Typically with an ACL tear, you're gonna have pretty immediate swelling and stiffness, and some of the tests they're gonna be doing are called the Lockman test and the drawer test. Those are 2 easy tests they're gonna be doing back in the locker room to try to assess for any instability in the knee joint itself that could indicate that the ACL is damaged. The PCL is often hurt via a similar mechanism, but not as common, and you're going to be doing the same sort of tests and just in the opposite direction for the PCL. Let's look next at the meniscus. So a meniscus injury is typically from some sort of twisting and bending at the knee, so kind of similar to what happened here. Basically, whenever the bones are pushing together and twisting, that subjects those meniscus structures to increased force, which can cause them to shear and little pieces to break off. Sometimes a player will feel or kind of hear a pop whenever it does happen. And then on their exam, they're going to be doing something called a McMurray test that we commonly do in clinic to try and see if he's having any locking, catching, popping, or pain with moving that knee joint through different exam maneuvers. Next, let's think about the two ligaments on the outside, and those are the LCL and the MCL, and those help provide more stability in the vertical direction to the knee joint. If you look back at the footage here of his injury, you can see that knee bending really far inward, and so if you can imagine a ligament stretched across that joint, as you bend more inward, it's going to get pulled and stressed more, and so one thing that could be going on is a possible MCL sprain. Similarly, if the knee bends in the other direction, more outward, then you're stretching that LCL on the outside of the knee joint. Back in the locker room, they're going to be doing something called a varus and a valgus stress test. And basically the player lays on his back, they have the knee extended, and then they push on the knee in different directions to try to stress those ligaments to see if A, there's any laxity or increased movement, and B, if there's any pain. So those are the most common things that we would think about in the acute kind of management of an injury like this on the court, and the things that are going to probably be running through the trainer and the medical staff's head when they're evaluating Zion. Again, I don't know exactly what happened, and we don't have enough information to even speculate on what this is, so I don't want to say, oh, I think this is for sure what it is, and this is what it means for his career, because we really don't know. But hopefully that gives you some insight into the different things that the training staff is going to be thinking about back in the locker room when an injury like this happens and they're trying to figure out what's going on. We can learn a lot from the footage, but ultimately it really depends a lot on the physical exam to get a sense of what's happened. I'm sure they're going to do some sort of an MRI tomorrow to get an exact look at what's going on, and then we'll give another video update once we have an official confirmed injury. I hope you learned something about kind of the acute management and evaluation of a knee injury, and hopefully reviewing the footage gave you some insight into how these different structures might be damaged in an injury like this. Thanks as always for watching, and we'll see you guys in the next video. Bye.